Tere tulemast vaatama COVID-19
Welcome to join
vaktsineerimise
us.
infotundi,
We have a briefing on COVID-19 vaccination where the experts are providing answers to your questions, which you can submit, dear viewers. So these are for the people who still have doubts regarding the vaccination decision to give you additional assurances. So that all of you can submit your questions, please use an environment, worksup.com. In order to enter that platform, you go to website worksup.com and your keyword is Vaktsineeri, and this is how you end up on the website. And to ask your question, you can click on Küsi, ask a question. So you can ask your questions in Estonian on this topic, and to submit the question, please press the green button. So when you have the questions submitted, you can view them and you can rate these questions when you press on thumbs up, and therefore more popular questions will rise up, and therefore there is a greater likelihood that these questions will be submitted to the panelists. So over the next hour, we have the experts who will be responding to so many questions as we could possibly do it here during this briefing. In addition, you have a possibility to submit your questions over the telephone, calling 628-4034. So I repeat, 628-4034. And this briefing can be also viewed in English with the simultaneous interpretation on news.err.ee and on WorkSup website using the keyword Vaktsineeri. And as I mentioned, then we have the experts here in the studio. So first of all, I would like to introduce our guests. So we have the Chief Physician of North Estonia Regional Hospital, a member of the Scientific Council, Professor Peep Talving, Head of Scientific Council for COVID-19, Professor Irja Lutsar, a member of the Estonian Family Physicians Board, Dr. Argo Lätt, and the Deputy Director of the Health Board, Marianne Härma, and Estonian State Agency of Medicine's Pharmacovigilance Department, Maia Uusküla, and the member of the Health Insurance Fund, Maivi Parv. So before we move on to the questions we have, as a warm-up, I have some questions. And this is a question based on my own experience. My grandmother, who's 92, and she goes out, goes to the shop, meets her girlfriends. I go and visit her, and I've been in many, I have many contacts because of my work. And unfortunately, some of her friends have left us because of this disease. She was vaccinated end of January. Second dose she received in February. But at the same time, I'm now worried. When is she going to get her third dose? Because as far as I know, her antibodies in her body are reducing. I will start, because first of all, we need that the European Medicine Agency will give the permission for third doses for some of the pharmaceuticals. I understand that your grandmother will be in the first category or the highest risk group who needs a third dose. Because once the immunity goes down, it goes down for the elderly. So once the European Medicines Agency certifies some of the pharmaceuticals for additional dosage, then once this permission is there, you will get a booster. And I would also like to say that the vaccines are still very good to avoid this very difficult disease. So they're still efficient, and so your grandmother can be assured. So I have some questions now, and here is one of the questions. Have you studied scientifically how many people, when they're vaccinated, will infect other people less, and compared to the people who are diseased? So we have had many surveys. This started from Cambridge, where the healthcare workers, once they had Pfizer one-dose vaccine,
nende meeskonnas olevate töötajate haigestumine oli peaaegu olematu, ehk siis
almost none of them fell ill. So people had one dose. When it came to infection, they were protected quite well. Then in June, there was an article in New England Journal of Medicine where they looked at the 4,000 frontline workers, including clinicians and workers in hospitals, and they found that the people who have been vaccinated, then they have a lot smaller virus load. They become negative a lot faster. So there's a clear impact. You can see that vaccination protects other people from being infected. And then there was epidemiological study in the UK where you could see that, yes, indeed, vaccinated people were less severely ill. They also disseminated virus during a shorter time period, which means that they disseminate this disease less. What is the guarantee of impact for vaccination? We do not know yet. We right now know that as long as the vaccines have been available, so from December to January, so this is how much we know about it.
Maia Uuskülale küsimus, kes vastutab selle eest,
who is responsible when a 12-year-old received Pfizer and their heart stopped and health has not improved? Is there somebody here who will apologize to the boy and his mother? First of all, I would not really believe these stories which come up in Facebook, on social media, or what you will have some acquaintance somewhere reports. It is always possible to inform us of an adverse event from a parent or the person themselves, but we have never received such notification of this adverse event, so I do not consider it to be true. So I understand that this example is a rumor, but factual information you do not have. No, we have no such factual information. So if indeed somebody's had a heart stop, then it will be very serious adverse events. The doctors are obliged to inform. Parents can always inform. So there is no such information, so we consider it a rumor. Why do you need to vaccinate 12-year-olds? How can you be sure that there is no long-term impact for their health? I can answer this. We know that children are not often first victims, and children often have a quite lighter version of the disease, but we have to keep the schools open. So we know how many children have been infected right now, but these children who are vaccinated and infected, then you can count these on the fingers of your one hand. Yes, indeed, this is information we have is only short term, and vaccines have a couple of months of adverse effects. Long-term adverse events have not had, and almost none of the vaccines have any long-term adverse events. So how do you process the adverse events of the vaccine? So what is the damage or harm from the vaccine? Because if we talk about the headache and fever, then this is not a damage or harm from vaccine. A couple of days of joint pain is not a harm from the vaccine. So what would this be harm? Would be this death or disability? Unfortunately, today, there is no compensation for this kind of outcome, but I know that the Minister of Social Affairs is discussing it. So when it could talk about complications, then there are single cases, thinking about 1.4 million doses administered. In nursing homes, post-vaccinations, why there is higher mortality and increased health issues? So I would also ask, where do you get this kind of information? Because after vaccination, at the beginning of the year, when in care institutions and nursing home vaccination started, then the morbidity was reduced. So we had less than 1% of the cases which came from care institutions when the infection rate went up at homes and schools and places of employment. or unknown sources, but the number of cases in care homes went down. So therefore, vaccination helped the care institutions and the infection went down. This autumn, we can see that in care institutions, infection rate is going up. But we also have to take into account that in care institutions, we have changing population. We have new people coming in. And some people have not been fully vaccinated or they do not have all the antibodies yet. So today, in care institutions, the vaccinated people get infected, then they do not have a severe case of the disease. And these people who have been vaccinated and have a more severe case of the disease, then they tend to be quite elderly, and usually they have very serious comorbidities. So if you have a fairly healthy elderly person who has been vaccinated last spring, if they were to be infected now, then usually this is not a severe case. They tend to have an easier case. So basically, this answers to the next question as well. How many people do you have among the infected who have had coronavirus already, and whether they've been in hospital? We can answer that once you've been infected, you get very good protection. You have a lot of antibodies, and so there is a spike proteins, and but the price of it is that we do not know who's going to have a very severe case. So this is this herd immunity discussion, whether we'll be all sick. But then people started to die, people who did not take the vaccine. So I think the herd immunity, and to hope that you will have a good, easy case, then this is not sensible. And we know that people who end up in hospitals, we have a few anecdotal cases. If I look at the statistics of my hospital, I can say I can't even recall any in the hospital who already been infected. So they said one person was infected twice in China, but these were anecdotal cases. So pregnant women or women wanting to fall pregnant, or are they, if they are breastfeeding, can they take the vaccine? This is a daily question for GPs. In Estonia, all the available vaccines allow vaccinations for pregnant and breastfeeding mothers, and there is no harm to the fetus, and the vaccine is not excreted in the breast milk. And there is another case, pregnant women actually tend to have a more severe cases of the infection once if they are infected. I looked at the Swedish infection statistics. I looked at the women in the fertile age, and 35% of them were pregnant who were in intensive care units. So the risk is definitely there. And we have a vaccine. So if you have a study in impact, you have to measure in different time periods. And the researchers say that coronavirus long-term adverse effects do not exist. How can you claim that if this kind of research cannot be done? Because they deal with the disease and the vaccines are new. In near past, we know that there is a connection with the viruses against swine flu and narcolepsy. I suppose that it's a human flu, not swine flu, or the 2009 pandemic flu, where indeed there was a connection to narcolepsy. But now if you think back, but these came very quickly. So the flu started in December, November, and already by spring, these adverse events were the information was available, and now coming back that these vaccines, mRNA vaccines, are on the market for the first time, but they have been studied and tested for 20 years. So the technology and vector technology and mRNA technology is not anything new. When it comes to the other vaccines, then we can get this a lot of information, so we know that there is no long-term adverse events. Maia? Maybe I would also like to add that when it comes to the vaccines, we are still studying them because we have the marketing permission within the certain time period, but the people who have participated are observed at least for 2 years, and now it's been over 1 year, and we have not seen anything dangerous.
Why isn't a positive antibody test sufficient to prove
antikehade testi
COVID
selleks, et
Today we use
kui
an antibody
antigeeni
test.
test või antikeha test on
Antibody
positiivne,
test, if that is
siis
positive,
inimesele võib
then
teha ühe vaktsiinidoosi
you
selle asemel,
can
et teha
have
kahte.
one dose of
Nii et
vaccine for a
antikehade teste
person
ikkagi
instead of two.
arvestatakse.
So antibody
Aga miks
tests
ta
are
ei
taken
ole
into
läbipõdemise
consideration. But
tõendamiseks,
why
selle
isn't it
tõendi
sufficient to
väljastamiseks?
prove
Kõige lihtsam vastus on
infection with
selleks, et ta ei
COVID,
ole
or they have
Euroopa tasandil
recovered
niimoodi
it?
kokku lepitud.
The
Ehk siis
simplest
me
answer is we
väljastame ka oma seda
don't have this
rahvusvahelist
agreement at the European level.
tõendisertifikaati, mis
We
vastab
issue
sellele
an
Euroopa
international
Liidu,
certificate that corresponds to
Euroopa
EU
Liidu standardile.
standard.
Ja Eesti on mitmeid kordi selle teemaga
Estonia
viinud Euroopa
has raised that
nõukogu
issue,
tasemele, et
at the
seda
European,
õigust nii-öelda küsida, aga
Council of
siiamaani ei ole
Ministers
selleks
many
Euroopa tasandilt
times.
ka
So far,
vastukaja tulnud.
we haven't
Küll
had
ta
any
on
feedback
hetkel
from
aga
Europe.
ikkagi arutamisel
Right now,
Sotsiaalministeeriumi
it is
tasandil, on ta
under
käinud ka
discussion
valitsusest läbi, et
in the Ministry of Social
ikkagi
Affairs, in the
ja ka
government,
immunoprofülaktika komisjon on
and
andnud
also
selle
the
kohta seisukoha, nii et ma usun,
Immunoprofylactics
et siin võib
Commission
lähiajal näha muutusi.
has their stand
Kas
on this, so
erinevalt
we are going to see
vaktsineeritutest viiruse
changes in that, I
läbipõdenute
believe.
kehas ei teki mälurakke, mis taaskäivitavad vajadusel
Unlike the vaccinated
ise
ones,
siis antikehade
the
tootmise.
recovered people have
ei vasta tõele.
immunological
Üks
memory
küsimus, mis tuli mulle
cells.
juba enne veel,
Well, that
kui
is,
me avasime
they do have these
keskkonna
memory
emaili
cells
teel
both
ja
in
küsimuse
vaccination. And that
küsija küsib siis, miks on mõni
question is,
aeg pärast vaktsineerimist nii
why
palju äkksurmajuhtumeid,
there are
et
so
täies
many
elujõus
sudden
inimesed
deaths
teevad
after
õhtul plaane
vaccination.
järgmiseks päevaks, aga hommikul
Perfectly
enam ei
healthy
ärka.
people
Küsija
make
loetleb
plans
terve
for next
hulga
day
tuntud inimesi, kes
after
viimasel ajal on
vaccination,
siis
and they just don't
siit ilmast
wake up
lahkunud
next morning.
60-ndates
And they
eluaastates.
list several people in their
see
60s that
peale
have
küsib,
died.
et nii meil
And the question
tekibki
is,
ju umbusk ja
so
kahtlus,
we
et koroonavaktsiini
have
mõjul
suspicions
tekib südame
that
seiskumine,
as a
kuni
result of
me ei tea tõde
corona
surmade
vaccine,
põhjuste
we
kohta, seni
have
teeme
sudden
järeldused ise.
cardiac arrests and other reasons for people dying suddenly.
Ütleme, sellise statistika juures tuleb väga
Based on
selgelt
the statistics
seostada,
we
mis
have,
oli
we need
inimese
to
taust.
map very
Kas
clearly
olid
what was that
riskifaktorid
person's
kuskil, kas
background, were there
inimesel
risk
oli
factors,
arterioskleroos, kas tal
does the
oli
person have
südamehaigus,
arteriosclerosis, did they
südamepuudulikkus.
have any
Siin
cardiac
tuleb
problems.
terve pilt tuleb kokku
We need
panna,
to
sa ei saa
take the whole
seostada
picture. You
ühe
can't link
doosiga, kas
one
see oli
dose
päev
of
tagasi või
vaccination,
nädal
whether it
tagasi.
was a
Kindlasti
day
ei ole
ago
antud meile ju
or a week
ajahetki,
ago.
mis oli
They don't give us
ajaline
any
seos.
timeline.
Nii
What was
et,
the
ma ei
time
saa
relation?
kokku panna neid
I cannot
fakte,
put
mida
together these
küsija loeb
facts
ette.
that the person
Ja
asking the question
neid
is
siis
listing.
ühesõnaga üheselt siduda, nii
So
nagu
there is
küsija
no
küsib,
way of linking
meile ei
them
saa.
Selleks on
in a definite
oluliselt
way.
rohkem vaja fakte.
No, we need a lot more facts for that.
Ja see on tavaliselt, kui on tekkinud
Usually,
surmajuhus,
if
mida
there
võiks
is a
seostada
fatality that could be
vaktsineerimisega, on
linked
see
to
põhjalikult
vaccination,
uuritud.
it's usually very
Ja
thoroughly
see hulk
investigated.
nimestikke, või
And the number
juhtumid, mida te ette
of
lugesite,
cases
kuidagi
you've
ei ole
listed.
minu mälus, et see oleks
And
kuskil
I don't recall
Irja.
that these cases have ever been discussed. I'd like to add here that there was a British study and they have carried out many studies. They have looked at the vaccinated and unvaccinated people and compared death rates. There were no differences. So I think there
Ja
are
aitäh, kui läheme
random
küsimustega edasi.
coincidences.
Tuletan vaatajatele meelde, et teil
And
kõigil
I'd
on
like to, we'll
võimalus
continue with
esitada oma
questions
küsimus, minnes
very soon, but you can all ask questions at workshop.com, enter the hashtag Vaktsineeri, and you can ask your question there, and hopefully that will be brought up in this hall, in the studio. When we'll have an inactivated vaccine like Novavax in Estonia. Novavax contains proteins, but yes, the technology is different. Some inactivated vaccines are being assessed. It all depends. If they have a positive assessment, then to the best of my knowledge, it's not in the next few months. Neither protein-based or inactivated vaccines are not going to be approved in the next few months, but it's in the process. If a person cannot vaccinate themselves for medical reasons, but then everybody is threatening that the unvaccinated person is unfit for medical treatment, they have donated to the medical system through their taxes generously, and doctors do not care about their Hippocrates oath. I can start here.
Tegelikult
I
on ju
can take
niimoodi,
that one.
et turvalise
Actually,
tervishoiu tagamiseks me
in order to
testime
guarantee
kõiki
safe and
inimesi, kes
secure
hospitaliseeritakse.
medical care, we
Aga
test
meil ei kuskil
everyone
vahet, kas
that is
inimene on
hospitalized.
vaktsineeritud või
But we
mitte,
never
selleks, et
draw a
anda
distinction
ravi.
whether a person is vaccinated or
Ehk
not.
siis
They'll still get
kõik
treatment.
saavad abi, mida
Everyone
nad vajavad
gets help
ja
they need,
tema vaktsineerimise
and their
staatus ei erista
vaccination
ühte
status
teisest.
will not make a difference here.
Aivi Varv.
ja võib-olla veel nii palju lisan,
Maria?
et tõesti vaktsineeritud
I'd like to add
või
here that
vaktsineerimata inimesed, et kõik meie
vaccinated
riiklikus
or
ravisüsteemis
unvaccinated people
samaväärselt ja
are
samamoodi
equal in the public
aga võib-olla
healthcare
ka
system.
siin saate
They
alguses
are
oli
treated
jutt, et
in the same way.
kui nüüd
In the
pärast
beginning of this
vaktsineerimist
program,
inimene tunneb
we
ennast
said
halvasti, tal
that
on mingi
if
tervisemure,
somebody
kas see oli siis
feels
vaktsiiniga
poorly
seotud
after
või mitte.
vaccination,
Ega siin jälle
and if they
ju
have
inimesele on
concerns
arstiabi,
whether
tasuta, ta
vaccinated
pöördub
or
oma
not,
perearsti poole,
then
võib-olla
healthcare
sealt
is
edasi
free.
suunatakse eriarsti
For
juurde
them, they
ja
go to
sealt
their
edasi ta
primary
saab
caregiver,
siis läbi
then
meie tervise-
special treatment
tervishoiusüsteemi
or experts, and they'll get help from the
kuidas ma saan oma vaktsiiniskeptikutest
medical
tuttavaid veenda selle
system.
ohutuses, kui nad toovad mulle
How
reaalseid
can I
näiteid,
convince
kuidas
my vaccine skeptical people when they bring me examples
tõsiseid kõrvalnähte.
from their nearest and dearest that have side effects after vaccination? First of all, every case is unique. Please turn to your GP, your primary caregiver. They know the person's illnesses and can find out what happened. When did it happen? Is there a link? Is there a link to vaccination? What is the timeline? There are so many rumors right now. And among friends, these stories become, shall we say, creative. All facts need to be checked. What's behind the story? And I don't know what they mean here by reflexes. That's a neurological problem. Contact your GP. They will check it, carry out initial studies, initial tests, and then refer to a neurologist. In addition to that, people can call 1220, which is the advice line, and you can get answers there, answers to your medical questions. And if there are organizational matters there, it's worthwhile calling 1247. Timeline, you have a vaccine today and tomorrow or in a week. There is another problem with your health. It is tempting to link it to the vaccine, but skeptics could be influenced by numbers. There are 1.4 vaccine doses given out, and less than 200 cases of side effects have been notified. That is a minute number. And these have been, most of the majority of them are treatable. I do encourage people to talk to your doctor about these side effects of these concerns. If we speak about side effects, which kind of a vaccine you recommend? Do different vaccines have a different impact on others or different protection? No. All vaccines are equally good. There are certain age limitations. AstraZeneca vaccine is not recommended for younger people because there have been very, very rare cases of thrombocythemia, but usually the difference between the vaccines are minute. Do corona vaccines contain dangerous metals? No, they do not contain dangerous metals or dangerous compounds. If people have doubts, they need to take the information sheet that lists all substances that are used in production and removed from the end product. How do you explain the additional number of deaths during the pandemic that was higher than during the COVID deaths? We've
Arengu Instituudi ja Teadusnõukojaga
excessive
ja
deaths
need
with the
kõrged tipud olid
Healthcare
suve ajal, kui oli
Institute
kuum ilm.
and the
Ja me vaatasime
Science Council.
väga
We
teravalt ja
saw
ma tean, et
peaks
Tervise Arengu
during the
Instituut
heat
vaatas
wave in
iga
summer.
juhu läbi. Ja
Healthcare
need
Institute
surmad
reviewed all these cases
olid
and
kõik
these
muud
deaths were
kaasnevad haigused, olgu see
all
onkoloogiline diagnoos,
accompanying
südamehaigus,
diseases,
kopsuhaigus. Me
oncological,
ei saanud kuskil
cardiological,
kokku seda, et
pulmonary
need oleksid
diseases. We could
COVID-ist
never
tingitud surmad.
match them with deaths from COVID. Other countries, the British have said that they do have more deaths than in previous years. And of course, years are not equal and they haven't found anything special about it. Maybe there is a byproduct of corona pandemics because they could not access medical care because other people were there with their COVID.
Vaktsiinidoosi korraga kõigile
Why
soovijatele.
isn't the third dose of vaccine available for everyone according to their wishes? At the same time, we have 700,000 people vaccinated, and if they all decided to go and have another one, a third one at the same time, it would be a chaos. Those that are pushier will get it first, and those who need it most will be at the end of the line. First of all, we are looking at who needs the vaccine most. As I said, as we started in the beginning, the moderator's grandmother is the age group, is the one where we see reduced immunity, or people with reduced immunity, or frontline medical workers. But at least, but at some point there will be others. Because today, if we look at people that have ended in a hospital, then in fact, there is nobody there who is less younger than 50 vaccinated and then ends up in a hospital. There are very unique cases. It is younger people don't have such a pressing need for a third dose as older ones. A booster dose and the additional dose, these are two different concepts. One is one is for people who don't have antibodies, who are immunocompromised. That is something that we're going to have regularly, like the flu vaccine. But what is clear is that the first and second dose are most important. The third dose is meant for a certain target group, but the first and second ones are the ones that will take us out of the pandemic. With the third one, we will not vaccinate ourselves out of it. And we can't have a third before the first and second one are done. We speak about third doses, but we have hundreds of thousands of people who haven't had neither the first nor the second dose. So I'm rather inviting people to vaccinate themselves so we can put some kind of a cap on this pandemic.
Kas statistikaga kõrvalmõjude kohta on Eesti riigil olemas ja miks kardavad vaktsineeritud mitte vaktsineerituid?
And why are the vaccinated afraid of the unvaccinated ones? Yes, we collect data on side effects. You're all welcome to notify us from there. Doctors must notify of serious and serious side effects. We have that information and we publish it on a weekly basis. Why are the vaccinated afraid of the unvaccinated ones? I don't think anyone is afraid of anyone else. Maybe the answer lies in
vaktsineerimata inimeste seas nakatumine levib lihtsalt kiiremini.
The fact
ja mida
that
kiiremini kasvab vaktsineerimata inimeste nakatumine, mida ulatuslikumaks läheb, seda suuremaks muutub ka tõenäosus, et vaktsineeritud inimesed võivad selle nakkusega külge saada.
And the more it spreads, the higher the likelihood that vaccinated people can get it. A vaccinated person spreads the virus much less than an unvaccinated one. And so it might feel that an unvaccinated person is more contagious. Does a vaccine create thrombosis? What is the rate of a thrombosis? If I have a genetic predisposition for enlarged veins.
Because today, if you look at the mRNA vaccines, then they are not really connected to blood clots or the thrombosis, and there is one very specific syndrome for AstraZeneca. today we have had over 1 billion doses of coronavirus vaccines administered. That means everybody monitors very carefully every month all the data. So all sorts of neurological issues of thrombosis are always reviewed. We cannot really connect blood clots of thrombosis with this. Then if you look at the all the blood circulation issues, then it's a wide topic. But there is no varicose vein and vaccination connection. So if if you have over 5,000 antibodies, but just after I have recovered, because all the medication has adverse effects, where is the profit, or if you think about the number of antibodies I have, or the risk?
COVID-tõendiga jälle oleme selles samas olukorras, et kuigi me antikehasid arvestame
although antibodies we are considering when people are being vaccinated, but at the same time we are not really issuing a certificate for the presence of antibodies, because this is related to the COVID European Digital Passport. We are reviewing it in Estonia and the Ministry of Social Affairs. We have discussed it with the government as well. So we have had Immunoprophylactics Commission that yes, indeed, antibodies we can be considered for a person who has recovered. So hopefully we'll see this in the documentation as well. Viewer says that in January I had COVID-19. In August I had a first vaccine and I got a COVID passport. I want to go and travel next month, but in my country destination they only consider fully vaccinated if I have two of the two doses. That means that I have to take a PCR test. But when I went vaccinated, I was told that I can have a second vaccine. But now, calling the information line, I was told that if I've been once vaccinated and recovered, they will not receive a second vaccine. Is it true? So maybe I'll start here. Yes, indeed, once you've recovered with a medical indicator, you will need to have at least one dose 6 months after you have recovered. And we know that and we take that into account. But at the same time, when you're traveling outside Estonia, this is not the rule in all the countries. And people who vaccinate take that into account. So if people have a reason to get a second vaccine dose, then this will be administered. So in this case, I would recommend this person to contact the place of vaccination where they receive the first dose, and I'm sure that they will get the second dose as well. So that means that it gives them better possibilities for mobility. As there are many situations like this, come to GP to vaccinate, and of course we will vaccinate, and it is allowed as well. How dangerous is it? How dangerous is coronavirus for kindergarten-aged children? Usually they have a very easy course of the disease, and they also infect others less compared to teenagers. But we have to bear in mind that there is a certain syndrome or multisystemic inflammatory reaction which is very rare, fortunately, and this can be a problem for kindergarten-aged children as well. We have had 16 such cases in Estonia during this epidemic. Why are the vaccinated people allowed to move around if they have get coronavirus, although they can spread the virus as well? Well, this comes from the people who have been vaccinated who are spreading the disease less compared to unvaccinated person. And vaccinated people have a less chance to have the disease, so we have to look at the risks. So if all the people were vaccinated, then nobody would have to be in isolation. Why the vaccinated people have to suffer and not being able to receive planned treatment because other people are refusing to get vaccinated? So maybe in hospitals, hospitals should consider the people who have been vaccinated as a priority. This is clearly an ethical issue because we don't differentiate, as we said before, based on somebody's conviction when it comes to vaccination. And this is not going to happen. We're not going to prioritize one category of patients over others. And we cannot really now oppose vaccinated people compared to unvaccinated persons. So you should always think that what it is what I do in order to make sure that this pandemic is over and my children can go to school. What is it what I sacrifice? Should we vaccinate every year? Well, nobody knows the answer. Will it be every year? Is it only booster and that's it? So this is very early to answer. So this is the first successful coronavirus vaccine we have, and so we cannot really answer this question yet. A year from now, perhaps we know more. Second question, when do we get rid of restrictions? Well, some of the countries have gotten rid of the restrictions. Denmark, for example, because they have very high level of vaccination. Norway, the same. And probably Finland will follow this example soon. So that means if we have enough people with antibodies, because antibodies are not only coming from vaccines, but also from having the disease and having recovered. So once these conditions have been fulfilled, then this is the route we will take. Marianne Härma. I wanted to add
kui me vaatame, küsimus on konkreetselt piirangutes.
Because it's a question of restrictions, but what are the restrictions in Estonia right now? Because we're talking about the measures, actually. We do wear masks, which is a measure, it's not a restriction. We show our COVID passports, but at the same time, the services are accessible, and this is important, quite important easing compared to the previous wave. And if we think about the countries where they are getting rid of the restrictions, we have not had such severe restrictions as for a year as some countries have. So if we think about the restrictions and lifting the restrictions and sensibility of these restrictions, then Estonia is a really good situation. So dear viewers, I would like to remind you that these questions are not mine, are not provided by anybody else but yourselves, and so you can submit your questions. Please visit worksup.com. The keyword there is vaccineeri, and you can submit your question. And hopefully I can ask this question from the experts. Let us continue. So the representative of the health board has said that only small share of adverse effects are reported in social media. People tell their personal stories where somebody's had very severe adverse effects and informed the doctor who, without any research, says it's random and is not going to report this as an adverse effect. So what is your comment? What we have done in order for all the adverse effects to be reported, and then we'll start with the GP. So here, it's a question of communication. So has this patient been really talking to the GP over the phone or sending an email? And whether the GP or physician are aware of this case, first of all, and patients themselves can also report the adverse effects to the health board, as well as the clinicians.
Ma alustaks natuke kaugemalt, et need uuringud nende vaktsiinidega
So first of all, we have had extensive research on the vaccines, and we did find out this, we have vaccines which have post-vaccine reaction. Every second person might have a headache. So today, there's no point of informing us if this headache lasts 1 or 2 days. It's on the information sheet. You know that it might happen. But from the scientific point of view, I'm more interested if this headache is a week, lasts a week or 2 weeks, because this is a new information.
kõigil on võimalik teatada, aga
So
esmatähtis on rääkida
everybody can inform, but first talk to your doctor. And if somebody informs us, then they will ask if they talk to the doctor and you want to get information from the doctor as well. So please let us know if you have any adverse effects. Eduard asks, on 9th of September, his mother was infected with coronavirus in a care home. And a week later, she was sent to a hospital, and a little later, unfortunately, she passed away. Who is responsible? That a person who was vaccinated already, but she still died.
No, ega need vaktsiinid ei ole ju keegi kunagi öelnud, et need
Well,
vaktsiinid ravivad
vaccines do not treat all the diseases.
Ja ilmselt ma ei tea küll, kui vana see ema oli.
I don't know how old this mother was and what morbidities she had. And once the vaccines came to the market, then the efficacy was very high, 93, 94%.
Aga võib-olla ka vanematel inimestel ta oli juba siis natukene
But for older people, it might have been lower already then. So no vaccine or nothing in the world is 100%. So we can't really hold somebody responsible that this vaccine didn't work, because who is responsible that if unvaccinated person falls ill? So it's the same philosophical question. There is no good answers. But if you talk about the nursing care, would the nursing home be responsible? Well, I would not think so, but maybe state officials can answer better. So today we have not discovered any intentional spread. So if you have an employee who has taken this disease to their care home, and there are cases of death amongst the vaccinated people as well, but usually that means that these people have very serious comorbidities. And if somebody is over 90 or somebody is really quite elderly, as Professor Lutsar said, this vaccine does not make us immortal. But if this vaccine has been introduced by an employee, do they know? Does it mean that they violate the isolation requirements? Then the health board looks at it quite seriously. We have not discovered any intentional spread where somebody would be violating the isolation requirement, knowing that they are dangerous for other people. Yes, I think it also corresponds to the question submitted before, why people are vaccinated but still afraid of unvaccinated people, but that means that when you're elderly and you're weaker, you still have a risk. So when can we hope for a spray or a tablet? Spray vaccines are in first stage of research. And this is a very good idea, because this is, first of all, nasal spray. So if we have some sort of vaccine protection there, that is good, because for flu, these kind of vaccines already exist. But as far as I know, they have not reached very far yet. Let's see what happens if they get further. But when it comes to a tablet or a pill, then I think that some oral vaccines are used, but usually they are against diarrhea. So when it comes to this disease, I think oral vaccines are not very useful. How efficient is the nasal spray produced in Estonia? Well, this nasal spray is not medication, it's not a drug, because if there's antibodies and antigens, then there is a combined effect. But this is one of the measures, so you can spray it all the time, and maybe this will be then helpful, because this infection can come from elsewhere, not only nasally. It could be also your eyes. This is not where you can spray this serum. So this is a limited protection. And we do not really have any proper clinical studies carried out. So this is over-the-counter product, which has not had so much research, some experimental and animal studies, but not human studies.
On või millal tekib kõrvalmõjude kohta info,
When
mis on
will we
parema
have
ülevaatlikkusega kui see praegu
better information on adverse effects compared to the current information where it's difficult to read the statistics? Why would you have to have statistical information on the adverse effects? It's overview. And sometimes it's a pressure from the media who wanted to know how many vaccines, how many adverse effects. So this vaccine safety profile assessment is based on larger cohorts of data and run by the European Medicine Agency, where you look at the billions of doses. So if there is somebody who has a post-vaccine reaction which is linked to the vaccination, that's added to the information sheet and we inform. So for example, this mRNA vaccine and myocarditis, so you cannot really decide your vaccination decision based on Estonian statistics. Why do you not have very clear information under which health issues vaccination is more dangerous and why the people are not checked for these particular threats before vaccination? This information is available on the information sheet for the pharmaceutical on this vaccine, and maybe it's sometimes hard to find, but this information is there. And vaccination centers also ask questions, and these contraindications are very few. But you can always talk to your GP. Yes, indeed, I would also like to stress that when it comes to vaccination, then we always ask questions, we review the history, we are trying to find if there are any contraindications. So it's not quite that you will never ask anything and then you just vaccinate. If you have a young person who tends to have an easier version of the disease, why should they vaccinate themselves with the vaccine where we do not know what is the long-term impact and the herd immunity is not achievable?
Ma saan nagu küsimusest aru.
Yes, I understand what is being meant to this question, and I'm thinking
ja mina olen mõelnud, et me
laste hulgas, et nende what we think about it, because when it comes to children, school and mental health, because it's one of the corners of the society where we can also contribute in order to get rid of the pandemic, and only for these children and these age groups where we have had good research, and we have had good research where we can see that there is safe vaccination. So children can spread the disease, they take the virus home with them, and this is inevitable. It's unavoidable, but we have to reach herd immunity either through recovery or vaccination or through the combination. This virus will not disappear on its own. So one of the claims by Dr. Talving needs clarification. You say that we test all the people in hospitals. That's not true, because there is a lot of information from hospitals that they only test unvaccinated people, and people who have been vaccinated only test when they have had symptoms. So therefore, we do not have comparative data, nor can we draw conclusions how the spreading of the infection takes place in hospital among the vaccinated people. So all the people who have been vaccinated in the hospital where I work are tested. So regardless if they're emergency or planned patients, when it comes to planned treatment, indeed, we do not test everybody yet. Emergency patients, all of them, but for planned, not all of them. So here, indeed, you are right. But at the same time, what do we do? In addition, we do a repeat test. So all the patients in the hospital will be tested again on the second day and on the seventh day. And so this we have repeat tests. So this is what we have in the regional hospital. But indeed, if you are fully vaccinated and planned patients, well, we do not have high risk, we do not have this procedure.
If I could add that actually testing fully vaccinated people gives us incorrect results, because if the virus enters the nasal cavity of the vaccinated person, it will be met by antibodies, the virus will dissolve, RNA will be released, and when you take the test is positive. That doesn't mean that this person is infectious, contagious, or that they will infect anyone, or they will be ill. So we need to be very careful when we are start simply testing every fully vaccinated person who has no symptoms.
Vaktsineerimise kõrval haiguse enda ravist.
Little has been said about treatment of COVID. Is it usual to develop a vaccine first and then treatment? If and when can we expect to have an efficient treatment? No, it is definitely not traditional, but producing treatment, producing medications is not very easy. We are all looking forward to having it, something that would be effective because the virus spreads for quite a long time. Unfortunately, we don't have treatment options. There is a question whether we should boost the development of antiviral medications. We knew so far that antiviral treatment, well, if we don't treat it 7 days, if you do, it's only a week. We were hoping to get something, but we hope the world will be much better prepared against the pandemic than it has been so far. Do COVID vaccines contain cells from an aborted fetuses? No, it does not. In producing the human cells that in the 7th or 8th week, they have been harvested from medically aborted fetuses, but their cells are grown in a lab, and these cells are used in the final vaccine. COVID passport, somebody refused vaccination and committed suicide. Is COVID pass more important than human health? Mental health of COVID people is very, very important. We are all very concerned. None of us have seen that pandemic. It's like a war in trenches that keeps on happening, and it does have an impact on mental health. We are very concerned, just as Marianne said before. Therefore, we've had relatively few constraints in Estonia to protect the mental health, but it's not correct that nobody's interested. Why don't we have a public paper to fight corona fears and false information, where people would get answers to their fears rather than chasing for fake news on internet? The Minister of Social Affairs and the Health Board are about to publish an extensive campaign on fighting fake news and false information. And this is where people can read more on it. Experts will speak about the myths, will help to explain it. So do follow public campaigns that are in the pipeline. In addition to that, scientists from Tartu University and experts have given answer to questions, and I think Estonian Broadcasting Company has answers on their webpage as well.
leheversioon on täna ikkagi see vaktsineeri.ee.
Vaktsineeri.ee is a rather thorough, a rather good source where people can get information about vaccines, vaccinations, and it has gathered frequently asked questions here. Please check that out. Most likely people will get answers from there as well. Somebody asks, how can you say that before vaccination people will review their medical health if a perfect stranger vaccinates them at parking lots? The person vaccinating is responsible for vaccination and they should review medical history. If that has not taken place, it's hard for me to comment. But in my GP practice, I don't recall.
Need on erinevad sihtrühmad ka. Ühed on mobiilsed nooremad inimesed, kellel ei ole allergiat, ei ole mingisuguseid kaasnevaid haigusid. Anamnees on kerge võtta ja kiire.
These are different target groups. These who vaccinate themselves on fairs. They are young, mobile, and very few problems with their health. Those who go to the GP will be usually, their health would be more compromised and they will be checked. If the state will end paying for treatment, will that motivate people to vaccinate? Well, if somebody's already in a hospital, they have an outcome. And we come to an ethical problem whether a doctor has the right or desire not to treat someone. And I'd say, no, there are certain things that the state should not use force on. You need to help people no matter the reason for not vaccinating. Unvaccinated people often are afraid. They are scared of being vaccinated and can't punish people for their fears. WHO and UNICEF say that certain vaccines can be used on children, but children at risk. Many countries say that there are sufficient studies on vaccinated people and that can be recommended. Our immunological committee is speaking about vaccinating children at risk. However, we are having a campaign to vaccinate all children. WHO and UNICEF, they based their statement on a sentence, nothing is over when everything is over, drawing the attention of bigger countries to the fact that vaccines should be donated to developing countries rather than vaccinating children who go through COVID.
Ja ma ei arva ka, et lapsed on siin peamine või primaarne objekt, aga ma pean tõdema küll, et ma väga hoolega olen vaadanud vaktsiinide ohutust lastel. Ja need andmed, mis tulevad Ameerika Ühendriikidest, Kanadast, ennekõike need on suured riigid, kes vaktsineerivad. Need vaktsiinid on hästi talutavad. Samuti see, mida me näeme Eestis ja Maie võib-olla tahab täiendada, et need vaktsiinid on laste poolt hästi talutavad olnud, et see annab nagu selle kindlustunde, et ka lapsi võib vaktsineerida, aga ennekõike on muidugi vaja riskigrupi lapsed ära vaktsineerida.
Jah, et miks me lapsi vaktsineerime, on see, et vähendada seda viiruse levikut. See on võib-olla see punkt, mida ma tahan nimetada. Tegelikult me päriselt lapsi ju veel ei vaktsineeri. Me vaktsineerime alates küll lapsi 12. eluaastast. Kahel vaktsiinil on see luba olemas.
Mida peaks tegema inimene, kes on 80-aastane, kui tal on tromboosne siis olukord ning mitte vaktsineerimine on talle soovitatud, et mitte vaktsineerida? Mida ta peaks siis tegema? Kuidas ta saab oma eluga edasi minna?
What next?
No, esiteks tuleks uurida, et kes seda on soovitanud, mis põhjusel mitte vaktsineerida, sest et vaktsineerimise vastunäidustused on väga kitsas ring neid vastunäidustusi ja üldjuhul inimestel on juba päris tõsised kaasuvad haigused, nii et kindlasti ei maksa panna enda tervist riski sellisel juhul. Et kui on nii tõsised haigused, mille tõttu inimene tõepoolest ei saa vaktsineerima minna, siis tasub pigem vältida selliseid avalikke rahvarohkeid kogunemisi, vähemalt seni, kuni meie ühiskond ei ole nii palju juba vaktsineeritud, et teiste vaktsineeritus teda kaitseb.
Väga palju kuuleme, et ma olen nii haige.
I'd like to say something where people say, I'm so ill that I shouldn't have a vaccine. That's quite the opposite. If I'm so sick, I benefit most from the vaccine. Adverse effects are very, very limited, especially those that are seriously sick. I recommend you vaccinate. And there are so many grandmothers say, I don't go anywhere. But the virus will find everyone. It's just a matter of time. I'd like to thank all experts in the studio. Our good audience at your screens will sum up here. I hope things became clearer and stay healthy. Stay well.